Question 18 from Prep Test 158, Section 2, the first logical reasoning section. As always, we've got our highlight tool selected, and we're going to read the question stem first to identify what the task is of this problem. And we read, the reasoning in the argument is most vulnerable to criticism on the grounds that the argument blank. So we're looking to identify a flaw in the argument as it's presented, and we should be able to predict to a degree this type of big four predictable task of identifying flaw. So we're going to read the paragraph, understanding that we're going to highlight the conclusion as the main thing we need to focus on, and then we'll mentally predict what might be a flaw in that argument proactively before moving to the choices. Records reveal that of physical therapy patients who received less than 6 weeks of treatment, about 31% showed major improvement, regardless of whether they were treated by a general practitioner or by a specialist. Of patients who received physical therapy for a longer time, again, regardless of whether they were treated by a general practitioner or by a specialist, about 50% showed major improvement. Therefore, the choice between seeing a specialist or a general practitioner for necessary physical therapy will not affect one's chances of major improvement. And so the conclusion should be readily apparent following the therefore is about this idea that seeing a specialist or a general practitioner for necessary physical therapy is not going to make a difference. And the reason is because we've got similar percentiles. And whenever you are presented with a sample size involving percentages, you have to make sure that your percentages are drawing from the same general population. And so it's saying that just because 31% showed improvement and 30 showed improvement regardless of whether they were treated by a GP or a specialist, and then when it happens for a longer time, the treatment, you're still seeing a 50% improvement. Well, it doesn't mean that the physical therapy, whether it's done by a general practitioner or a specialist, you're pulling from the same populations. It might be that like a general practitioner is able to do it for just general injuries, but if you've had, say, a knee surgery, you really do need a specialist. So our predicted mental vulnerability in this argument really should be something like they may not be the same populations for the general practitioner versus the specialist when it comes to this physical therapy, even though the percentages showing major improvement are the same in the end. So, starting with choice A, keeping our highlighting tool selected to identify reasons to eliminate as we go, we read presumes without providing justification that effectiveness of different practitioners in bringing about major improvement cannot differ at all if their effectiveness in bringing about any improvement does not differ. Wow, is that not word salad? Now, you want to focus on the details when you're dealing with a word salad answer choice like this. And different practitioners is way too broad because we're talking specifically about a general practitioner versus a specialist. And just saying different practitioners introduces an ambiguity that we can't parse as far as being the flaw. So even though A hits on some of the issues within this argument, the idea of just applying it to different practitioners generally, as opposed to a general practitioner versus a specialist, makes A need additional information, and we can eliminate it for that reason. Next, choice B provides no information about the kinds of injuries that require short term as opposed to long term treatment. Now, again, the kinds of injuries, it's tangentially related, but it's more so about what types of injuries are being treated by general practitioners versus specialists, as opposed to what kinds of injuries are requiring short term versus long term treatment. We're basically evaluating the wrong comparison for choice B and can eliminate it for that reason. Next, for choice C, overlooks the possibility that patients are more strongly biased to report favorably on one of the two types of medical professionals than on the other. Well, again, if this were true, you'd end up with a difference in the bias in the percentages, but we don't have that. So this, if anything, in terms of being more favorable for one versus the other, is a reversal because it was 31% for both types, 50% for both types. So there isn't necessarily a bias, and we can eliminate choice C for that reason. Then choice D fails to indicate whether the number of patients surveyed who saw a general practitioner was equal to the number who saw a specialist. Well, the number isn't actually at issue. And whether or not it was equal, if it was like exactly off by 1 or 2 people, then there's no real difference. So you've got to make sure that you don't apply your own assumption to this answer choice to say, well, yeah, this is a big issue. Well, it could be a big issue if it was saying that there was a large difference in the number of patients for each of the practitioners. But it doesn't say that. It just says whether or not it was equal, and that change can be really minimal and have no impact either way. But then choice E overlooks the possibility that specialists and general practitioners each tend to excel at treating a different type of injury. And this is exactly the kind of distinction in the populations that we alluded to at the beginning of this problem. So if you've got a good prediction, you can move a little bit more quickly through the answer choices, and often you'll have something that matches, as does choice E for this question.